Welcome back. This part will discuss about the aseptic maintenance of equipments and clinical environment. Decontamination of equipments follows a sequential process including pre-cleaning soaking, pre-sterilization cleaning of the instrument, sterilization or disinfection, and storage of the sterilized instruments. Pre-cleaning soaking is usually done by immersing the instrument in 6% sodium hypochlorite solution immediately after use on a patient. It is done for about 30 to 40 minutes. This process reduces the microbial load on the instruments. After this, the instrument is subjected to pre-sterilization cleaning. Pre-sterilization cleaning removes gross debris, visible dirt, tissues, organic matter or foreign material from the instrument. It can be done either by manual debridement or ultrasonic cleaner. Manual debridement involves the use of a long-handled brush and scrubbing the instrument, paying particular attention to the hinges of the instrument. Ultrasonic cleaners produces ultrasonic vibrations and the instrument is cleaned by the process of cavitation. It is more advantageous than manual debridement in that it does not involve the manual handling of a contaminated instrument and also avoids splattering of fluid. Once the instruments are cleaned, they are allowed for thorough drying. Then they are packed and sealed, labeled, and then subjected for sterilization. Sterilization can be done by the use of physical agents or chemical agents. Physical agents involve the use of heat and radiation more commonly. Dry heat is produced by flaming, incineration, or hot air oven. Moist heat is produced by boiling water, steam at atmospheric pressure, or steam under pressure. Steam under pressure is the basic principle behind an autoclave, which is the most reliable method of sterilization. Ionizing radiations are X-rays and gamma rays, and non-ionizing radiations are infrared and ultraviolet radiations. Chemical agents commonly used are alcohols, aldehydes, halogens, and ethylene oxide. Alcohols denatures proteins and dissolves lipids that leads to cell membrane disintegration. They are effective against vegetative bacterial cells but has no effect on spores, and therefore alcohols are considered as low-level disinfectants. The commonly used aldehydes are formaldehyde and glutaraldehyde. Formaldehyde is markedly bactericidal and sporicidal and has lethal effect on virus also. Glutaraldehyde destroys vegetative cells within 10 to 30 minutes and spores in 10 hours, and therefore glutaraldehyde is considered as a high-level disinfectant. Chlorine and iodine are the commonly used halogens. Chlorine is effective against gram-positive and gram-negative bacteria, viruses, fungi, and protozoa. Ethylene oxide acts by alkylating the protein molecules. It is used for bulk sterilization such as syringes. Instruments are classified as critical, semi-critical, and non-critical instruments. Critical instruments are those that enter the tissue space or vascular system, such as an extraction forceps, and it is recommended that these instruments are decontaminated by using sterilization, such as an autoclave. Semi-critical are objects that contact mucous membrane except an oral cavity mucosa or non-intact skin. And high-level disinfection such as the use of a 2% glutaraldehyde for 10 hours is recommended for these objects. Non-critical objects are those that contact intact skin or oral mucous membrane, such as a mouth mirror. A low-level disinfectant using isopropyl alcohol 70% is recommended for these instruments. After the instruments are sterilized, they are stored in UV chambers. The maintenance of clinical environmental asepsis includes the use of air filters, surface disinfectants, fumigation, and management of biomedical waste. Air filters allows minimal entry of contaminants into the clinical environment. The clinical contact surfaces can be disinfected using surface disinfectants. The more commonly used disinfectants are 2% glutaraldehyde and hydrogen peroxide. The housekeeping surfaces and the floors can be disinfected using phenolic compounds. Fumigation can be done once in 2 weeks. Fumigation is achieved using formaldehyde gas, beta-propiolactone, or a solution containing oxone, sodium dodecyl benzene sulfonate, or sulfamic acid. Formaldehyde fumes are produced by mixing formalin with potassium permanganate. 150 grams of potassium permanganate is mixed with 280 ml of formalin for every 1000 cubic feet of the clinical volume. Formaldehyde fumes can also be generated by adding formalin to an electrical fumigating device. Formaldehyde fumes once generated, the room has to be sealed for at least 48 hours. Formaldehyde fumes cause irritation to the eyes, wheezing, running nose and respiratory distress. It is also carcinogenic. Excess formaldehyde gas is absorbed by ammonia. 250 ml of ammonia is used for every liter of formalin. Beta-propiolactone is another fumigating agent which is a condensation product of ketane and formaldehyde. A solution containing oxone, sodium dodecyl benzene sulfonate and sulfamic acid is also used as a fumigating agent. The advantage with this fumigating solution is that it can fumigate in 30 to 60 minutes. The management of biomedical waste includes the segregation of infectious and non-infectious waste products into color-coded bags and safely handling them for disposal. Thank you.